Hello everyone, my name is Rachel. I'm the registered kinesiologist here at Physio Supplies Canada, and today we are doing product training on one of our knee braces, the GENUDYN OA. This brace is used for management and treatment of osteoarthritis of the knee. We have both a medial and a lateral version of the brace, so if you do order it, please make sure you specify which area of the knee you are looking at. Right away, you guys can see that the brace is not parallel, so it does not run parallel to each other. There is a slight curve or angle in the structure. This curve and different angles of the brace incorporate the three-point principle. So just to give you an overview, the three-point principle is applying pressure in 3 different locations to help correct something that is occurring in the knee or any other area of the body. So to show you, we have our 1 point, which is right here, our 2nd point, which is right here, and our 3rd point, which is right here at the bottom. To show you guys how this works, I'm just going to lay the brace over my knee, and you'll be able to see that right here I'm feeling immediate pressure, along with right here as well, and then on the 3rd point. These points create the 3-point principle and help correct the osteoarthritis that can be seen in the medial part of the knee. With conditions like osteoarthritis, especially in the knee, there are some days where the pain can be at a level 5, some days it can be at a level 10, other days where you can have minimal to no pain at all. That's why Sporlastic has designed this brace to have this hinge and rolly on the side, and this allows you to adjust the level of unloading pressure that is placed on the knee. So right now, this brace is at our level 0, so that will be minimal unloading pressure on the knee joint. So I'll give you a look at the angle. Pay attention to up here and over here, and then I will show you it on level 5 and you will be able to see the difference. Adjust the brace by just twisting this wheel right here. So we've arrived at level 5, as you can see. And so now I will show you guys the difference. So right here and right here, the angle has changed quite drastically. And this would be if the patient is in a lot of pain and they need a lot of unloading pressure around the knee. Just to give you guys some anatomy on the knee, our knee joint sits like this. This is our femur, and this will be our tibia and fibula. And as we stand up, our knees are like this. And then when you sit down, your knee rotates like this. So normally, a lot of other braces create their hinge so that the knee hinges like this. This would show that there's a lot of unloading pressure still on the knee joint, but in reality, it rotates and it sits on top. Sporlastic has designed this brace that if you look here, this is the hinge. It's big enough to fit my finger in it, but then as we go to bend the knee, there's now no longer space for me to put my finger. This accommodates and makes sure that there's no unloading pressure on the knee while you're sitting down. The GENUDYN OA comes with 2 adjustable front straps. Ideally, these straps should be set by your healthcare professional, physio, chiro, whoever you're going to see, would set these straps, and after they are set, you would have no need to touch them. On the back of the brace, we have 4 straps that are adjustable through these novel devices that are easy to use as you just turn them to get a tighter fit depending on what you need throughout the day. The twisting novels are easy to release as you just have to push in and pull to release. The GENUDYN OA brace has an easy clip removal system where you just press upon one of these buttons located on the side and it easily clips out, and you can slide it back in for easy on and off of the brace. Again, right here, give it a push and then pull it out. On every GENUDYN OA, there is a Sporlastic barcode, which is our physio to go, which will have all of your stretches, physio exercises, and strengthening exercises for this specific use of this brace. For those with mobility issues in their hands or any spasms, you can easily use a pen to push the buttons to then remove the clip. For the GENUDYN OA, all you need is one measurement, and that measurement will be 14 centimeters above the knee joint and then the circumference of the thigh. So you will take your measurements device, find the knee joint, find 14 centimeters above the knee joint, and then take the circumference of the thigh at that point. The GENUDYN OA can also be used to correct any mild valgus and varus deformities within the knee joint. For this brace, you will need to specify whether you're talking about the right or the left leg, and you will also have to identify whether you are talking about medial OA versus lateral OA. When you order the GENUDYN OA, it will come with 0 degrees of flexion, and if you need to change that, it comes with stop adjustment pieces. And these ones, I will show you where to insert them. So if you take a look right here, you peel off the inner pads. Let's flip that. And you can see right here, we have the flexion stop on the bottom and then the extension stop on the top. And they also show the degrees of flexion and extension. So for flexion stop, we have 45 degrees, 60 degrees, 75, and then 90 as well. And then for the extension, on the back, we have 20 degrees, 30 degrees, and 40 degrees of extension stop. So these pieces are located on both sides, so you can remove both pads. Just make sure that if you place a flexion stop or an extension stop at a certain degree on one side of the brace, that you will have to place it at the same degree on the other side of the brace as well. In the box, you may also find 2 extra pads, and these can be used if you need an increased support or increased pressure. Thank you for watching our product training video on the GENUDYN OA. Please stay tuned for more product training videos from us. As well, you can subscribe to our YouTube channel so you stay up to date on our videos.